Hi,
Hi,
how are you?
I'm good. How are you?
I'm good. So, this is the first Facebook Live that I'm doing through the Wise Way to Success podcast. So, I'm
Excellent.
very, very happy to have you here. Um, it's going to be an interesting talk.
Yes,
I,
I think
I
so.
an interesting talk. We already have 7 people actually. How already?
That's
And we have
great.
um So this is, for those who don't know you, I'll start by, for those who don't know me, I'm Robert Wise, host of the Wise Way to Success. It is a mental health podcast. If you haven't subscribed, I encourage you to do so on YouTube and Spotify. So welcome the Wise Way community. Thank you so much for tuning in. Today we have frontline emergency nurse Melanie Jade. Melanie, tell us about you. Tell us about who you are and what you do.
So I'm an emergency nurse at background. I've been working in emergency room nursing for about 8 years now. I do have a background working in psychiatry as well, and our where I've where I work particularly at the MUHC, we get psychiatric patients. So I'm still active with psychiatric patients in care. I've been working, I used to work at a community hospital in local West Island, and then I recently, in the past 3 years, um, I went to emergency trauma, which is very different than just your old-fashioned emergency. We get car crashes, stabbings, shootings, and things like that. And during the pandemic, they tried to reserve us as a trauma center, but we did not always get as lucky. We do care for COVID patients during this pandemic, and we do see the outcome of what this pandemic has held for us. Um, Working in emergency room has really showed me a very different view on life. You tend to become more grateful for what is placed on your table. You end up realizing, oh, this is not as big of a deal as I thought it would be, because now I'm taking care of somebody who has way bigger of a situation. So perspective has shifted throughout the progress. And I have my nursing degree. I graduated from John Abbott College, and I have my bachelor's of science in nursing at from the University of St. Francis Xavier, and based in Nova Scotia. I have been I have also I'm the owner and founder of Nomadic Nurse Agency, which is a private mobile nursing services. And it was originally supposed to be something else completely. It was supposed to be emergency services for events, and of course, events did not happen. And I pivoted to helping the community during this time to not forget about people's general health and even mental health.
Well, you know what? I'm super happy that you're here. There are so many misconceptions about COVID. There are so many different perspectives.
Hmm.
So let's try to let's try to clear the air.
Yeah.
And by the way, for those who are tuning in, please ask your questions. This is a safe space. There's no judgment. So let's start with the first one, the biggest one that I get from people. This is a scam.
Mm.
A scamdemic. So let's clear that one right away. For those who think this is a scamdemic,
Hmm.
what do you say to those people?
You want to you want to see what I see?
And what do you see?
I see I see a variation of background. So keep in mind, my facility, they kept us as the trauma center as much as possible. We still do get COVID patients, but I do see if you don't see patients dying from COVID, well, I see patients dying from COVID. My colleagues see patients dying from COVID. The ICU at the Royal Victoria, we have specific units for that. And the impact that this has had on nurses, we keep in mind that we have lost thousands of nurses in Quebec itself throughout this pandemic, and because of this pandemic, not because of anything that's changed. We've already been working in in the healthcare system that was already broken, but we couldn't, some of us couldn't really afford to have it break even more than what it is. So so from the lens that you have, from the lens that people have here, where this pandemic has um, affected their social life, affected their family life, their relationships. Um, and you haven't, and you're like, well, I haven't known anybody that died from COVID, or I know somebody that got COVID, but it wasn't that big of a deal. Well, I know lots of other people that have gotten COVID and had to be intubated. I've taken care of those patients. And it's not a lens that I'm very happy to share. I don't think this is something that people should not feel. And it's not right. It's not right to be calling this a scamdemic or a plandemic or whatever you want to call it, when when we're actually seeing deaths, when we're actually seeing um lives being accounted for on this. Like, it's not right, and it's an insult to the profession in a way.
Okay. Now, I appreciate this open, candid interview that we're having, and I want to thank everyone who's watching, and hi back to the people who are saying hi to us, and are grateful for this talk. I think it's an important talk. It's a talk I didn't think could wait, for us to have it scheduled to be aired months from now. Another big misconception is the hospitals are really empty. They're not really as full as the news is making it out to be. What do you say to those people who say, well, I heard that the hospitals are not really as full as it's made out to be?
Where did you get your information? Along with all the information that you have been receiving, where have you been getting your information? Do you know somebody that works in the hospital? Because that's not enough to me. Because just because you know somebody that works in a hospital doesn't mean that you understand the bed management. And every hospital is designated to do different things during this pandemic. So, I mean, it's not correct to say that it's empty, because keep in mind that we are going to be um, keep in mind that we are trying to relocate and make sure that there's zero contact with, let's say, for example, who's a green candidate who basically does not have any COVID symptoms, that are coming in for a simple broken leg. We do not want to expose them. We don't want you to see COVID patients. Like, we don't want you to, that we've created, every department that has created a specific layout of their department so that you don't get exposed to that. Why would you want to see what's going on? Of course you're not going to see it, because we've created, like, for example, we have a department where it used to be psychiatry. We've modified it up over the time, but just to give you an example, at the beginning, the psychiatry unit was used as a pandemic ward because it was individual rooms. So at that time, we had our psych patients that went into a different section, and we screened them accordingly and such. But at the beginning, like, we created individual rooms. We created a bunch of negative pressure rooms, but you're not going to see these things in the waiting room. Like, no, it's behind the glass. So again, where do you get your information from? Who are you talking to? Because I can tell you right now that that's not the situation at my hospital, or my hospital that I used to work at, or the hospital where my other colleagues are working at, or the ICU. The ICUs are full. And that's not meant for you to see in the emergency room. And bed management is not something that you're exposed to. So before people decide to talk about what goes on in my industry, I'm going to come to you next time. When I decide to come to you and tell you how to fly a plane, we'll talk. You know what I'm saying? Like, we have to be very honest and transparent about this.
We have a question. I want to answer these questions too. I just saw in the news earlier today that Quebec recorded its first case of the UK variant of COVID-19. Scary. Could you shed light on this variant? Thanks a lot for all you do, Nifemi.
Hi, Nifemi. So the variant is unfortunately 70% faster to spread, which is questionable. However, from what I did my research on, thus to date, is that this virus is only affected on the spikes of the actual coronavirus. So you have the mRNA that's inside the coronavirus, you have the capsule, which keeps the virus viable, and then you have the spikes on top of it that make it a coronavirus, and it makes it COVID-19. And apparently this variant is on top of the spikes, which means that it does not affect that means that the vaccine doesn't have to be modified. So it actually is covered during the vaccine actually covers this because it doesn't change the actual mRNA. So the mRNA remains the same, it's just the spikes.
Okay. I hope that answers your question. I'm just going to go through, make sure we're answering questions. I want to say hi to everybody who's saying hi. Okay, so Jessica, why so defensive though? Everyone is entitled to their opinion. You're not the only healthcare worker, and some healthcare workers don't have the same opinion as you. So breathe. It's okay. I understand the situation sucks, but everyone is entitled to their truth. What do you have to say to Jessica?
So Jessica, thank you so much for bringing that up. You know, everyone's entitled to their own truths, 100%, which is where we're going to talk about, which has nothing to do with, you know, if other health professionals may be in a different situation, but bed management, when I hear somebody else talking about bed management when they know nothing about bed management inside of a hospital, of course, I'm going to get defensive because it's not logical to discuss something that is not in your mother tongue. It's not something you can't discuss about bed management and how hospitals are not full when you're not exposed to it. So of course I'm going to take a defense to that because that is my profession. That is something that I'm seeing, and it is a big spread of misinformation. It is and of course it's insulting because in all honesty, Jessica, no, I'm going to defend my profession. I'm going to defend what my bed managers do. I'm going to defend my my assistant nurse managers because we have worked tirelessly to ensure the safety of our patients, to ensure the safety of our staff members. And when we have people who don't know bed management, who don't work in the healthcare field that I'm in, well, first things first, an obstetrics nurse versus an emergency nurse are two variants of nursing. They don't understand the same types of the same dynamic of nursing. They're both great professions. They're both bring such a great benefit, but it's not the same discussion. It's not going to be the same bed management situation. It's not going to be the same care you're going to provide. You're not going like I will trust a labor and delivery nurse to help me deliver babies because that's not my specialty. But I'm not going to contact Jessica, who works in I don't know what, who has no history in how to manage beds, which you require a bachelor's degree to do so. To consult this topic, right? So of course I'm going to be on the defense. Of course I'm going to be insulted when I'm being told that hospitals are empty because I'm working tirelessly. I'm working like a dog to be totally to be totally transparent. And I understand that you're not trying to get with me, but there's nothing to breathe about. Actually, yes, you do need to breathe, obviously, but there's nothing to like. Yes, of course, I have to be defensive for my people, like 100%. So yeah, and if you whatever your specialty is, Jessica, whatever you do in life, we'll consult you for about that.
Okay, so actually Jessica wrote, she wrote, "Thanks, Melanie. I totally get it. I wasn't trying to come at you, LOL. It's just many healthcare workers have different versions, you know. And
Yeah, 100%. But this is my version. This is the same version across the healthcare system. So I mean, if we're going to talk about like every healthcare professional has a different opinion, 100% because they're in different fields or they're in different dynamics. But bed management, because we have to think in emergency where the patient's going to go. We have to do a bunch of preliminary stuff so we can make sure the person is placed to the proper bed, so we don't, we're not going to put a patient that's COVID positive and COVID negative in the same room. Like, you get what I mean? There's takes a lot of stuff. So I have to say that it's something that as a health professional, it hits hard, it hits home.
okay. Well, thank you for clearing that up. Actually, that's very helpful. So let's talk. I mean, I have tons of questions. That's why I wanted to do this. A lot of them you've answered with me on the phone, but I'd like them to be publicly answered. Let's talk about masks. Do they work? Do we need them? So let's debunk. I like to debunk.
Yeah.
So I would hear from people, maybe myself as well at one point, that masks do not work. They're not the right kind of masks. They're just a mask that you get at the dollar store. It even says on the back of the box, it doesn't protect from viruses. So why are we wearing masks if they don't work? Or do they work?
They do
Let's
work.
talk.
So they do work. It's just, so we've seen a lot of misconceptions about masks. And, let me just break this part down for you really quick. Operating rooms. We never said anything about nurses and doctors and health personnel and operating, excuse me. So it's something I don't think we discussed, but operating rooms can use a mask from 30 minutes up till 16 hours, depending on how long the operation goes. So we've never discussed on masks with people in operating rooms or people who work in operating rooms, and they're there for quite a long time. So, and then why do we use masks in operating rooms? There's no of COVID in there. You understand? You get where I'm coming from? It's to manage sterility. And there's a reason for this. So it's very important that, we understand the use of the mask. And it's not just the mask that we require. It's the mask plus a bunch of other things. So the mask, if let's say, for example, I cough just like this, no mask, it can go up to 6 to 10 feet, my cough or sneeze, right? But if I were to put on a mask, I can decrease that significantly. Let's say it goes up to 2 feet, okay, my sneeze. But if I have somebody that is wearing a mask as well, and they stand in front of me, the chances of spreading the spores when we're both wearing the mask, it diminishes significantly. But if we socially distance, that 2 feet, if to the 6 feet that's required, the chances of getting it is slim to none. So, and of course, when you shake the hands, that increases transmission. But I mean, it's not just the mask that you should be using, it's the conjunction of the mask plus the social distancing plus the hand washing that's effective. And the mask, it's true, it's not 100%. Nothing is 100%. Everything needs to be in synergy. Everything needs to work together. So when you say, oh, the mask is not guaranteed, of course it's not guaranteed. It's because it's a surgical mask and you're sneezing and it's to limit the sneeze. But when you socially distance, which is the rules that have been placed by the World Health Organization and CDC, it's because it is proven that if you were to sneeze and it goes up to 2 feet, but you stay 6 feet away, chances of you contracting is very limited. And I see Jessica writing, the level 3 surgical mask works. Yeah. N95 is the best, but unfortunately not available to the public. So N95, this is actually a really good topic. The N95 is used for aerosol procedures, especially we use it before COVID, we were using it for tuberculosis. And tuberculosis is extremely contagious and extremely deadly. And we actually do see it in Quebec. We do see it in our northern provinces, that when people from the north come over, they live in rural areas, we see this. N95s, when you're going in public, is not necessary. But it's the N95 an aerosol procedure, so intubated, or if they're on a big BiPAP or CPAP machine that pushes air onto your face, that it creates an aerosol. So that answers that part.
Okay. So I'll give you, I'll let you also scroll through the questions if there's anything there. And if there isn't, I have a lot of questions still.
So how many patients are currently in your hospital for COVID? I don't exactly know the exact number, but we did have, we're creating a designated unit. I know the ICU where I'm at is, where the ICU at my sister hospital is pretty full. I can't divulge exact numbers, but I can say that we are filling up quite quickly. Just the reason why I can't give you numbers is because I don't know the exact numbers, but we do have COVID patients. We have a pandemic zone that's full all the time. And keep in mind that my hospital where I'm at, they try to reserve us for like COVID patients, but later on, and we try to keep like the Royal Victoria or the Lakeshore and all these other institutions that are designated COVID centers to keep their patients. And if they overflow, they go into another hospital. So we try to keep them as focal as possible so that we can contain the spread as best as possible.
We also have an immune system question, which I think is interesting. You answer, it's from Safa, who I know very well.
So wearing masks and constantly washing and disinfecting everything is not in our benefit because humans need to be exposed to certain bacteria and strengthen our immune system. Doing this can weaken the system in the long run. Okay, so how many years have we not washed the surface of a shopping cart? Several years. Several years. There are many ways to boost your immune system without being exposed to bacteria, but keep in mind, we're only been non-exposed or washing our hands significantly for about 9 months to a year now, compared to the lifetime that you've had being exposed to bacteria. This amount of time is not going to affect your immunity to that extent, that significantly. In fact, we've actually seen decreased cases in flu. Usually we have about now flu cases, I think in the country in November, from what I saw, we're usually at 800 in the province, sorry. And we actually, in the whole country, we were 41. So the flu cases have significantly gone down with this. It's been actually quite beneficial. And there's so many other ways to boost your immunity without being exposed to certain bacteria or viruses as well. And given that we've been cleaning surfaces so frequently, it's been actually quite beneficial to prevent other things from occurring and preventing the other immunocompromised patients from getting sick. So maybe you can consult somebody to bring up your immune system in other ways.
Okay. So now here's another good question I think people might have. So we are social distancing. We are told to wear our mask. We've closed down restaurants, gyms, and bars, yet the numbers are still going up. Why?
People aren't really following the rules. This is not a real lockdown. Well, now it's a little different there, but if you were to ask that before, this is not a true lockdown. A lockdown, by definition, is everything is locked down. We are not having a real lockdown. At the beginning, it was kind of there, but we closed down selective things. And I can see, and in the public's eye, I can see how confusing this is to people. And it's very understandable because this creates a misconception. This is what creates mistrust and misconceptions. And when it comes down to this topic, guys, I felt we could do better for leadership. I felt we could have done better with the regulations. I felt it was very unclear. The restaurants and bars and such, it's I mean, and the venues have been taking the huge hit, and our local businesses have taken such a hit. And I think that we should have been, in my opinion, initially we should have been more aggressive where people were ready to lock down. Now people, if you tell people to 100% lock down, they can't do it. Like people fled to the States, or they fled to on a vacation. They can't handle that right now. And you know what? Given the amount of ups and downs that we've been receiving, I don't, in a way, I don't blame them. It's not the right thing to do to get up and leave and go travel right now. In my opinion, I can't do it actually. I cannot physically get up and travel. But the lockdowns are there needed to be a proper regulation so much earlier, so that, and even though I know Premier Legault was going on with the Dr. Arruda and Dr. B going on air almost every day discussing this, I felt when it came down to the lockdowns, it could have been way better handled, because now we are losing the trust of our people, and it's becoming more and more difficult. So we should have come up with a better plan earlier. That's 100%, in my opinion.
Okay. So a lot of people are concerned about the vaccine. They're scared of it.
Mm-hmm.
A lot of misconceptions were, this is all about a vaccine. This is to vaccine us. This is to get us all vaccinated up. This is to make billions of dollars and poison us. What do you have to say to the people who are skeptical, worried, scared about the vaccine?
So one thing's for sure, it is your right to get vaccinated or not. Because if we're going to talk about mandates and everything, I'm just going to clear the air on this part. Mandates, we had a reason to mandate the vaccine when we had the measles outbreak in Boulerice in the West Island and in some parts of the city. We had reasons to mandate because measles hasn't been around in decades, maybe even centuries, and all of a sudden it pops up again because people are not vaccinating their kids. That is a bigger reason to mandate a vaccine. Not saying that I would agree with 100% mandating it. That's not what I'm saying. I'm saying that to mandate, if you want to talk about a rationale to mandate a vaccine, well, at that time, having measles, which is deadly to children, that's a reason to mandate more than having this COVID vaccine to mandate. Now, whether the government mandates it or it's mandated across other countries, when it comes down to the vaccine, first of all, from what I've read in the ingredients on several articles, spoken to several people and that have a history in epidemiology, microbiology, and virology, we have all looked at the data, and the actual vaccine appears to be very safe. It's actually safer than than other vaccines out there. And I do vaccinate quite often. In my company, we do offer vaccines in pharmacies and offer vaccines mobile. So I have to do my research on vaccinations. And I've been asked several times whether I'm going to get this vaccine on my roster. I'm not going to get it on my roster privately, simply for the fact that this vaccine has gone into the hands of politics, not in health. And I don't feel that is why I'm selling this or why I would be selling the vaccine, or would offer it to my clients. I rather leave it in the government's hands because it's gotten too political. Like it's science at the end of the day. I've been vaccinated for all of my vaccines when I was a child. I'm perfectly fine till this day. And for those who don't want to vaccinate, that's okay. You have the right to not vaccinate. However, don't judge people who want to be vaccinated, and we won't judge you. Now, I know it's a little bit back and forth, but we need both parties need to be better at this, because I understand why people are going to be waiting a little bit to want to get vaccinated. However, from what I've read, the ingredients are as simple as lipids, which you need to help pass the barrier. You have salt water. You have sugar, sugar is the base of everything. It's the base of carbon. It's like basic cellular biology. And you have the mRNA strand. You do not have the actual virus injected in you like other vaccines do. You don't, which is even safer. And the mRNA, the messenger RNA that is going into you, it does not mutate your DNA. mRNA is just the strand. DNA is the full, like, actual, like, DNA strand. So it's not the same, it's completely different. It's just there so that the receptors are created to recognize the actual virus when they come in contact. So that's why your immunity, when people get symptoms after vaccines, well, this is very normal because your immunity has to create antibodies to protect you from seeing the virus, no matter what virus this is. So that's just the general of how vaccines work. Now, there's a lot of details to it, but it's creating soldiers to help recognize that, to recognize the virus when you come in contact with it. So if you were to come in contact with it, you won't get the virus. Or because it's 95%, if you get in contact with the virus and you actually contract COVID, your symptoms will actually be significantly less. And you'll be protecting others at the same time.
Okay. So, we're getting some nice thank yous. I'm happy that we're doing this. We're currently in partial lockdown and the numbers are still rising. You've got to boost. You've got boots on the ground. I don't see us going back and then doing another lockdown again like a yo-yo. What's your take, Mel, on how we can bring this down?
So this is a very good question. This is a very important question because it's not, and it's something that I've been saying from the very beginning. We need to work together way better than this. There's too many separates. Everybody's too segregated. People are not listening to each other. We're fed up. We're tired. We want to go back to a normal life. And this will not end if we don't communicate, if we don't work together. So what do I mean by this? Now, I want people to come on here and bring their opinions on how this pandemic has affected them. Okay? Everyone has a different view on how this pandemic has affected them. And that view is not incorrect, just so we're clear. It's not incorrect. You have been exposed to this virus in a very different way. Your mental health has taken a hit, or you're like me, where you've been exposed to the deadliness of it. You're like probably someone who's never seen this virus or doesn't know anybody that has been exposed to this. Or they don't know they've been exposed. There's a lot of variance to this, and I know a lot of people are developing their own truth behind it. And it doesn't mean that, well, I'm seeing dead people, with people dying from this virus, so your thing is not real. No, that's not it. Mental health is taking a hit. Mm-hmm. We are getting a mental health hit. So like nurses and health professionals are getting a mental health hit, 100%. Like there's nurses that were working in clinics, that were working in maternity, or they're on maternity leave or anything, that are being forced or being asked to work either over the phone, on info santé. They're asked to come back. Retired nurses are asked to come back. That's not a joke. It's happening. Like I know, like we don't allow our nurses who are pregnant to work directly, but they're asked to go work at over the phone on info santé, or giving out COVID results. We need to listen to each other better with this. And we know that one thing that we have to make very clear is politics and science do not go together at all. Politics have ruined science, but we have to be accountable that we should listen to our people more. We should be accountable that we should not gaslight our patients anymore. We should be accountable that we need to take the time to educate the population again, and trust in us again. And, say, listen, we have to slowly spoon feed them. And which is, what, I understand, because your exposure to this is very different than mine. And you don't want to see my lens. It's not fun. It's not great. Not only have I seen people die from COVID. I've seen people have mental health issues because of COVID, because I still work in an emergency ward where we get all types of patients, including psychiatric. It's not I'm very, very well aware of what everyone is feeling. I'm very accountable for the actions of our health professionals. I'm very mindful of how you're feeling, because you want to know what? It's okay to feel what you're feeling. It is okay, but some people need to sit down and agree to disagree and say, how do we end this today? And the truth of the matter is that no matter who let this virus go or how this started, that doesn't matter. Today, it's killing people. That's my lens. That's not impossible. That's what's happening. It's killing people quicker than the flu. I'm telling you that right now. We need your help to stay home, to wash your hands, to wear a mask, and to advocate for what's right. And then once this is over, once we see our numbers going down, trending downwards, then we'll talk about human rights. Then we'll talk about, because we got a bone to health professionals. Our human rights have been violated. We're being forced to work extra shifts. We didn't ask for that. Our position was supposed to be X. Why are we doing Y? We've been doing forced overtime for a very long time. Our human rights has been affected. We have been we've gone without lunches. So what about our right to eat? We haven't got we wait to go to the bathroom. We don't drink water. We drink coffee like crazy. Like, we have a stressful lifestyle. Our human rights have been affected as well. And we hear you on that one, but this is a little bit of our medicine here. And we want you to work with us, because we get you more than you think.
Oh, we're getting such positive feedback, and people are really appreciative of this talk. I think it's an important talk. I think that we need to know, we need answers. Our life has been very, we all look at our own personal lives, and it's everything has been so uprooted that we also have a little bit of empathy for the health professionals out there, for the nurses, for the people who are in the front lines, because we have the people who are like, well, I don't see it. No one I know has it. Why am I having to stay home? I've seen posts on Instagram, on Facebook about medical tyranny. This is medical tyranny. They're trying to control us. They're trying to mask us. I've heard the term sheep. The people who are wearing masks, you are all sheep. You are all going to the slaughter. It's going to be a one world government. And, you keep hearing this dialogue. And I think it's really, really important. I actually spoke before this interview with you. I spoke to a young lady, 97 years, who called me up, and she actually asked me to help her granddaughter. And we were having a talk right before this about the she's at a senior residence, about people thinking it's not real. And she goes, "Are they nuts? This is for sure real. Why would they not even believe in flus and pandemics for hundreds of years? Every 100 years, actually, there is some sort of pandemic." She couldn't even grasp or understand the idea that anybody would think this is a scam, that this is fake. And I think it's these misconceptions that people believing it's a scamdemic, it's a plandemic, it's to control us, is prolonging what could have ideally would have been over with way sooner if people actually believed it more.
Yeah, because at the end of the day, people are not used to wearing a mask, and I understand that, but it's not like this is unheard of. The mask, like if you go into an operating room and the doctor's not wearing a mask, or personnel's not wearing a mask, if you're getting an operation or appendix removed, you wouldn't question that. Like, you know what I mean? Like, it's just, the mask is to mask us and to close our mouth. Like, it's not a political statement. Like, I've been wearing a mask in the healthcare profession since I've started in nursing school. I've been taught how to use masks and what they're used for. Hand washing was actually our first session, and you know what? When we say how many times we wash our hands, I mean, we should have been washing our hands way better before. Like, do you know how many people on a shopping cart like pick their nose and then like push it before this pandemic? Or like touch something and then push, you know what I mean? Like, and some of us are actual germaphobes with it, but I mean, now we actually wipe down those surfaces and we don't hear of these other things. So, I mean, we could have ended this way sooner if we had more collaboration. And of course, if we dealt a little bit better, you know, if we were a little bit more, unfortunately, I feel at the beginning, if we were a little bit more aggressive, more continuously. I know people were getting fed up and everything, and it's very legitimate, but we would not be this long in it. And on top of that, we have to I keep in mind, I'm American, so we need to take into the leadership from our allied country. I'm not going to talk about whether I'm pro-Trump or against Trump. That's not the point that I'm trying to get to. But obviously, the Trump leadership and administration had a very different opinion on the virus, which obviously led to a lot of misconceptions. And it wasn't followed on science anymore. And people were believing the news. So it's this. Here's the thing. I don't listen to the news when it comes down to science anymore. I do not listen to it. If I see something on the news that's questionable, I'll research. I'll be like, yeah, okay, I see where this is coming from. Unless on the news is with a doctor that I've actually personally worked with, or I know somebody who has worked with that person. So, for example, our Canadian base is good, but whatever goes on in the US, I don't give a shit. Straight up. Like, I don't care. I don't listen to it. I think that if you're gonna put out information, you need to research it properly right now. And misinformation has been our worst enemy. We've been fighting misinformation. So it's very important that, you know, you inform yourself adequately. And sorry, but the media is not a place to do that. Facebook is not a place to do that. Instagram is not a place to do that unless you fact check the person that's talking. And that's actually that's providing accurate information. And with that being said, if any of you guys are on here that have information that you have on this scientific information that proves things about this pandemic or lockdowns or anything, I am more than happy to read it, fact check it, and help guide you with it, and also learn from it.
So Jessica wants to know, why did they wait? Why didn't they make masks mandatory at the beginning? Why wait?
Jessica, that is a great question. Great question. So they weren't sure. First of all, the reason why they didn't mandate masks at the beginning and why we were saying no mask, no mask, no mask. Remember all that time when they were saying don't wear a mask? They should have been upfront a little bit more about this, but the reason why we didn't want everyone to go crazy and buy masks is because we had no masks at the hospitals. I remember how scarce we were running on masks. Scarce. Like it was, I could not believe it. It was like third world countries scarce. And, you know, and masks, I had to purchase PPE for my company, and it was costing us a freaking fortune. The amount of medical equipment that we had to buy, that I had to invest in for the company, the amount of, and I can only imagine what the hospital had to invest. I could only imagine. And, you know, you had to buy in bulk. Like, it was so this is just pure business. The demand increased, the price increased. Supply and demand. It's the same thing. So we were very scarce, and the goal was everybody stay home. We wanted everybody to just stay home. And if you were infected, you would wear a mask inside your home if you were living with other people. But we didn't want you to go out being positive and go and wear a mask. No, that's not what we want, because you can still be contagious. So, I mean, the mask mandate was not initiated quick enough because, one, we were scarce on masks, and therefore we mandated people to stay home. That's why we did lockdowns and everything, and our highways and streets were completely empty. Which then, but when we started getting more supply, then, you know, that's when we started opening up. But clearly, it's just wearing the masks are not working. You need to use everything in synergist. Now, I'm not saying that masks don't work. I'm not saying that. I'm saying that we need to use other forms and conjunctions with the mask.
Right. So Caroline has a question. Can you talk about all schools? I work in a school. Your thoughts on transmission and spread at this point?
So first things first, where do kids come from? They come from home and then they go to school. They don't, and that's the same thing for the teachers and the personnel as well. Before you go into a location, what is going on at home? Because it's the same thing for education. Like, when we educate our kids and the teachers are like, well, what's going on at home? That's where this starts from too. What's going on at home? And I don't mean what's going on at home in the sense that, like, are the parents following the rules? No, it could be that a parent unfortunately got infected, doesn't know. Like, there's no reason to judge on this topic. And I think that if we talk about schools, it's very important to consider that getting kids to wear a mask, I understand it's difficult. I get it. I can only imagine what the kids feeling, and they're like, and on top of that, the extracurricular activities that they're missing, like it's not the same. Like I grew up in an industry where where I professionally danced, and I did competitive dancing all throughout high school. I danced all throughout elementary school, and my brother played elite sports as well. I do not understand how kids are going through this time without having that. And you want to know what? Which is the more reason why we need to find a way to stop this and be more proactive with this. Now, there's some parents out there that are doing their very best, and unfortunately, they've been exposed and they don't know, or they've been exposed because they're caring for a caregiver or for a family member. Like there's a lot of rationals, but then there's other people that just like, send their kids to school, and they're not vigilant about those things. And we need to get better with that. And more reason why we need to work together for the future of our children. Like, we have to get better with it.
So Joel has a question. So Joel, part of your question has actually already been answered. So I definitely would encourage you to rewatch this live when it's up on my Facebook page. Second part has not been answered. So the part about the vaccine has already been answered, but the part about the new strain, what do you think of that? That we haven't touched on, the new strain of COVID-19.
The new strain of COVID-19 is significantly faster spread, so more reason why we need to be more vigilant. And keep in mind that there's a lot of travelers. There's a lot of travelers. There's a lot of people that left the province or left the country and went to travel.
So I don't get why they didn't. Sorry, I just don't get why they didn't put a ban. To me, that's ridiculous. How could there not be a ban on travel? There's a lockdown and a shutdown, and yet there's not a ban on travel. And again, it starts to, we're stuck home.
Yeah, 100%.
To Mexico.
100%. People are going to Tulum. People are going all over they're thinking they're safer abroad. Some people are actually traveling for legitimate purposes. Like, I know somebody that has their husband stuck in Cuba right now, like stuck, because he's a Cuban citizen, and they're married, and they're having a hard time getting him over. She wants to go get him and bring him back. And then I know somebody that we do COVID swabs mobile for our clients, and I know a lot of people that had to go to New York or go to their country because their family members are going through a medical procedure, or they're dying. So those are legitimate reasons to travel. I know that some people are looking to get away, but I kind of, because the back and forth with the regulations, I get where they're coming from, but it's not the time. Unfortunately, at the end of the day, I have to say it's not the time. But do I want to travel right now? Yes, I do. Even if I wanted to, I actually cannot, given my job. Not because I own a company, because of the fact that I'm a nurse, and I'm not going to quit my job just to travel. But I mean, there's going to be a lot of people coming back, and I have to actually read up on it. But apparently, there were some regulations that the government of Quebec put in. So the new and given and how does this have to do with the new strain? Well, if you look into airports, there's so many people crossing through airports and from various countries. Airports right now, and the country where you land may be safe. For example, Punta Cana may be safe, but the airports are not guaranteed, is like at all. And we have so many people crossing. It's like a cross-contamination free-for-all in there. It's a super spreader spot, 100%. And I'm not very surprised that we have the new strain this quickly, or if it mutated, or if it, I'm not, we didn't get a better, we should be getting a better grip on it. And, like I know at the beginning, I know it's tough, and I know that the government doesn't really have a COVID-19 pandemic book. They have a pandemic protocol, but I mean, there's only so much that they can do given that protocol. But I mean, it doesn't tell them, not every virus is like COVID-19 or like Ebola or like the Spanish flu. It's very different. They're all very different.
So, we're almost wrapping up. We're doing this live feed, and I think we got a lot of information out there. What is something that maybe we haven't touched on that you think is an important thing for people to know right now or do?
So what I want people to understand is, please do your research properly. And if you don't understand the research that's coming to you, because it's a lot of it is medical jargon, like let's be real here. Consult a medical professional. Turn off the news a little bit. Turn it off. No matter what country you're coming from, turn it off. Because politics don't determine what happens in science and what happens in the hospitals. Like, they'll be there to notify us. Luckily, our news is not that bad. But I've been on the media on several occasions, and I've seen people, colleagues go on the media. And here we act in Canada, well, in Quebec, or where locally, we have a very good, we do have a good outreach with it, but we need to be careful what we see on Instagram, Facebook. I've seen so many people advocate for very dangerous things, and it as a health professional, I know that some health professionals are fed up because we're isolating. It's not good for our elderly, it's not good for our psychiatric patients. I 100% understand that, but isn't that more the reason to combat this virus? If we know that this virus is causing all of this increased suicide rates, increase in poverty, affecting the future of our children, affecting our local businesses, affecting the economy as a whole. The only person that's winning in this is pharmaceuticals and medical industries, but governments are losing tons of money on this. Why would we put in a pandemic for us to win? If we wanted something, we would just go to war. War makes more money than this. It's proven. Like, makes much more money than this. So we need to be more mindful of the information that we're spreading. We need to be kinder to one another. I have never seen so much back and forth hate towards one another. We shouldn't be segregating. We should be communicating. We should be working together, no matter what your view is. Because at the end of the day, the goal is simple. You want to end this pandemic. I want to end this pandemic. You think it comes from some type of, I was going to say conspiracy theory, but you think it comes from, I can't even say it. It's like, I don't even understand the logic behind, I don't understand it. But if it comes from like a lab that was released, I don't know all the details, but I'm saying that, listen, it's affecting people today, or this is just, and you're saying that it's a mask is just a mandate to silence us. At the end of the day, can we just, how about this? Let's let science do its magic. Let's put the numbers down. Let's actually follow rules. Let's actually be a little bit more severe with our rules. See what happens, and then we'll reevaluate. And because we want to make sure our numbers go down, we can't continue like this.
No,
It's So I understand when people tell me suicide rates are going up, why are we continuing with this? The more the reason we should be more severe and end this now. Our future of our children's at stake. The more the reason we should work together to end this now. The local businesses are losing money and going bankrupt. The more the reason to end this now. That's what I have to say. Because
I agree. And, you know, for those who know, I co-founded an anxiety and depression clinic. I'm a mental health advocate. I struggled with my own mental health, my own anxiety. I'm seeing so many people struggling, people who are addicts, losing that group support, in-person group support. It's a very hard time. We need to end this. I really appreciate you taking this time, Melanie, and, you know, just laying it out there, real, no holds barred, just giving it to us straight. Melanie will be a guest on The Wise Way to Success. She'll come to the office and film an episode and talk about more about mental health, what to do to stay safe, to stay healthy. For those of you who are looking for extra mental health support, I absolutely encourage you to check out my channel, The Wise Way to Success. I encourage you to subscribe. It's completely free and there's amazing tips. I mean, this is to me a no-brainer. The Wise Way to Success has life-changing tips and strategies to help with your mental health completely for free. So I would encourage you to not only subscribe and watch the videos from Worrier to Warrior, how to beat the holiday and winter blues, lots of tips, how to overcome guilt and shame. I would actually encourage you to share it with your friends, share it with your family. This is a very hard time. I created this channel during a pandemic because I wanted to reach more people. People were coming to see me and saying, Rob, this is so helpful. This is such helpful tools. And my value system was I need to get the word out there. I need more people to know about mind traps, thought distortions, fears, phobias, anxiety, how to get over them. This channel is completely free. The tips are life-changing. You're not going to think the same way when you watch these videos. I would encourage you to subscribe, share, and help people. People are struggling. People don't have access to therapists. They're expensive. The hospitals are overwhelmed. Check the channel out. Coming in January, I have a psychotherapist coming to talk about anxiety in teens. There's no end to the knowledge that I'll be providing everybody. Melanie's going to be back, and we are going to help people. This channel, I tell people I'm on a mission. I'm on a mission to help people live their best life. That's my mission. You're on a mission too. You're on a mission to save lives.
yeah, absolutely. We need everyone's collaboration. We need everyone's help and I'm not talking about this from a politician standpoint. I'm talking about this from a healthcare standpoint. We need your help. And we are asking for you to develop faith again, and we will. And I, as a professional myself, I oath to do better. I oath to be a better health professional for you. I want to make sure that we are people that you can trust again, given that what has happened. We want you to have faith in us. We want you to consult us. We want you to ask us questions. We are here for you. We are doing our very best to combat this virus. We have a lot of our own struggles that we're dealing with our healthcare system that we have to combat at the same time. And we know that there's a lot of things that we need to do better on a political standpoint, on the healthcare system framework. But we are doing our best to make sure that you are accommodated, and a resource like Robert's Clinic is absolutely incredible to consult, to talk to. Keep in mind your truth is not incorrect because you've been exposed to this virus in a very different way. It is totally okay because you haven't seen through my lens. It is okay, but all I ask is that you get the proper resources that you need. You consult somebody if this is correct. Consult Robert. Robert is an excellent resource for this. If you have questions, if you're feeling down, if it's December, like it's been gray for a month, a clinic like Robert's is excellent to talk to. And and as health professionals, I will do my best to do better for you. We will, we know that the healthcare system has failed some people before this pandemic, and we want to do better. So we will work on that for you. We will do our best to make sure that this is better. We will fight for that for you, because a better healthcare system for us to work in is a safer place for you to be when you're vulnerable. So I don't, doesn't matter what your views are. I just ask for you to stand with us and to be mindful that we want to end this pandemic together, and find every way to boost your immune system, keep your mental health safe, and keep your sanity. It's so difficult, and we love you. We thank you for tuning in, and it's very important to stay safe.
It truly is. Melanie, it's a pleasure. I'm going to leave the links up above for the Wise Way to Success podcast. It's also available on Spotify, completely free, and great strategies and tips. I'll also leave Melanie's contact information if you want to reach out to her. She is a wealth of knowledge, and just the type of professional that I enjoy working with, somebody who wants to share knowledge and help people. And, we're here to help you, to educate you, to help you feel supported, heard, respected, understood. And I know it's a lonely time and it's a scary time, and we are here, and I'm not going to stop. As of January 3rd, I made a commitment to people. I'm going to be giving new content twice a week, even doing some more live feeds. The last thing we need to feel is alone and isolated during this time. And I'm here. I'm on a mission, and please feel free to write me, to reach me. Like Melanie said, I'm a great resource in that. I understand. I do. As somebody who has gone through it, I mean, I really have gone through horrible anxiety, fear, and the feelings that come with a pandemic, and the feelings that come with the unknown and what that does to people. I understand it. So please feel free to reach out to us. You are not alone. This is, I like to call this, actually was my producer who actually came up with this, and I loved it. It's the Wise Way community. And that's how I feel. It's like, welcome to the Wise Way community, where it's an open discussion. We're here for you. If you have a topic that you want to hear about, if you want a mental health professional, or you want to hear on something, reach out to me. I'll see if I can make it possible. Let's be together. I love what you said, Melanie. There's so much segregation for some reason during this time. It doesn't make sense. We need each other more than ever. We are treating each other like we're enemies. Like I walk, like I'm walking in a grocery store, and people are like 2 meters. I'm like, oh yeah, sorry. Like we're all segregating so much, but we need each other. Actually, I think we need each other more than we ever did before.
Yeah.
So let's be there for each other. Let's be there for each other. And I love that it's a safe, open space, that yes, we could agree to disagree. We could have your opinion. I'll have my opinion, like the whole vaccine. Respect my opinion. I'll respect your opinion. I'll listen to you. You listen to me. And, at the end of the day, that's all we could ask for is the mutual respect and understanding and support from each other.
100%.
So
Thank you so much for having me. It means a lot.
Very, very shortly in person. And I want to thank you all for tuning in. It's a discussion that was very important. It's also a discussion that many people want to avoid. I don't want to hear about COVID anymore. I'm done with COVID. So I appreciate you all tuning in and educating yourself through this 1 hour live Facebook feed. Melanie Jade, you're fantastic. I can't pronounce your last name, so I'm keeping it Melanie Jade. Melanie Jade, but how do they find you, Melanie?
You can find me on Instagram at Nurse Melanie Jade B, and you can find me on my company page, Nomadic Nurse Agency, at Facebook, on Facebook and Instagram. You can find also my website for my company, nomadicnurseagency.com, and of course, Facebook.
So thank you all. Have an incredible evening. Stay well, stay kind, and stay safe.
Yes.
You all have a great night.
You too.